So I'll go ahead and kind of start off my little intro as a few more people are popping on. And Dr. Weiss and I were just sort of catching up a little bit. We don't get to see each other as much as we used to, and I used to call him in the middle of the night from the emergency department. So thanks for fielding those phone calls and never being grouchy. I don't know how you do it, so I appreciate that. As you can see, Dr. Weiss was nice enough to wear his bow tie today. For those of you that are not directly in medicine, you may not realize that the bow tie, when you're a doctor, you have to have a certain set of credentials to pull off wearing a bow tie. It's like wearing really wild, loud golf pants. You better bring your A game when you wear those pants. You have to know how to play. So you either have to have an Ivy League education or multiple doctorate degrees or specialists in areas of things people don't understand. And certainly Dr. Weiss has all of those credentials. So you certainly have earned your bow tie, and I'm glad that you wore it tonight. And so the other thing that you may not know is that Dr. Weiss will occasionally change his bow tie for those cute little running shorts. And he also is quite an elite athlete. So when you see the marathon runners on TV or in real life that run like a jackrabbit, and the young people are striving to keep up and have to stop and pass out on the side of the road, and Dr. Weiss just runs on by them, you sort of wonder how he does that. So whether it's the bow tie or the running shorts, Dr. Weiss is usually dressed for success. So thank you for showing up in your bow tie today. A couple things just for Dr. Weiss to earn his bow tie. So he started his undergrad at Yale. Then went to NYU for medical school, and then moved along to Columbia Presbyterian Medical Center, where he did his residency. And his specialty is cardiology, if you haven't figured that out from the invite and the title. He did some fellowship at UCSF, both in research as well as his clinical fellowship, and then moved on to do some postdoctoral work at Stanford. So if that's not a list of places to go and places to see, I beg you to come up with a better one. But he and I both spent a little time, although at slightly different times of life, out in Oregon. And we've chatted about that at times. And then now he and I are fortunate to work together here at Newport. And we're really fortunate to have him as part of our CVI, which is our Cardiovascular Institute, which is the larger enterprise of Lifespan in its effort to really improve cardiovascular health and looking at cardiovascular disease throughout the state of Rhode Island. So Dr. Weiss has been part of our medical staff at Newport for, I don't know how long, Joe, a long time, many years.
About 6 years. Six years.
All right, yeah. Awesome. And so he's got a couple of areas of particular interest, cardiac genetics and things like that in particular. I know you've done a lot of research studies on those as well. He's really brought some of the really high-tech imaging for cardiac disease to Newport Hospital, heart flow and CT angiograms, things that you can normally only get at these big mega medical centers, but are available to our community in Newport, which is pretty fantastic. So huge appreciation for all the work that you do in Newport. And, I wanted to have Dr. Weiss on to chat with the folks on this one. And it looks like we have quite a few attendees popping in, just because for me, one of my favorite questions is, if you don't take care of your body, where are you going to live? So we all, I think, need to do a little bit better job of taking care of ourselves. And it gets harder when you're in a pandemic and you can't go outside in the snow and run. It's a little bit icy and tricky. And so how do we eat? How do we sleep? How do we take care of ourselves? How do we manage stress? A lot of different areas we could potentially go with this. But I have a strong interest in staying alive. And so I think if everybody else can rally around that idea, then talking to a cardiologist with his knowledge will be really helpful for all of us to be a little healthier and manage through the winter. It is Heart Health Month for February. So good time to talk about that as we're kind of in the low point of winter and starting to look towards the spring and things starting to warm up. So folks, just a couple of housekeeping things. So my name is Jeff Gaines. I'm the Chief Medical Officer at Newport Hospital. So you can certainly type in questions and things if you have for me or for Dr. Weiss. There's a chat function, and then there's a Q&A box. They both will pop up, and I'll be monitoring those. And even better yet, after Dr. Weiss talks for a little bit, what I can do is I'll have the little attendees, and then Dr. Weiss and I have the ability to click a little button that says allow to talk. And so if you want to put a little thing in a chat or a little thing in the Q&A, then I can switch you over and you can talk and you can ask questions live. We'll fiddle around with the technology. We'll see how it goes, but I think it'll be a great opportunity. So without further ado, as they say, I shall hand it over to you, Dr. Weiss. Thanks for taking some time tonight.
Sure. Thanks, Jeff, for the very generous introduction. Happy to be here. I think everybody is suffering under the pandemic. It's gone on too long. It's wearing us all out. And it's probably one of the biggest stressors any of us have endured. speaking personally, and I think also scientifically, I've found exercise to be the best medicine, if you like, for coping with stress. And as Jeff alluded to, I'm a runner. I started in college. I've pretty much been doing that my whole life since then. And there's nothing that compares to it for relieving stress, dealing with mental confusion or anguish or anxiety. And I just have to say, at least it's been incredibly valuable to me. And I think it's accessible to anyone. In the winter, of course, we sometimes have a little more difficulty going out running, but you can still go walk. And even in the northern climes, in the Scandinavian countries and in Canada, you find people in the frozen north who are very active, very healthy. And so don't let the weather be an excuse for neglecting to do what everyone knows that they should do. With that said, I thought I would start off by pointing out one of the hazards of winter, because cardiologists know from all too much experience that winter is actually one of the periods of vulnerability. And we see more heart attacks in winter than in summer. We see more in the morning than in the evening. And the fairly classic scenario is somebody who wakes up after a snowstorm, goes out to shovel their walk or their driveway, and then experiences a heart attack. And of course, that the lesson to be learned here, and that I want to emphasize, is to be careful and to know your limitations. And by that, I mean that when people go out to shovel the snow, it's often a level of exercise or activity to which they're unaccustomed. They may not exercise regularly. They may even be very sedentary. I think that's the typical scenario. And they're forced to do something very strenuous, and they can't avoid it. And so, unfortunately, sometimes they do something foolish, which is to exercise or exert themselves at a level to which they're unaccustomed. And this has actually been studied, not necessarily in the context of snow shoveling, but in the setting of sports. So we know that people sometimes have heart attacks during sporting events, and so actually it was studied in Rhode Island by a famous exercise cardiologist. And the surprising finding was, or maybe not so surprising, that people who exercise regularly have a 50-fold lower risk of having a heart attack during sport compared to people who are sedentary or weekend warriors. And I think we can extrapolate those findings to what we see every winter with snow shoveling. It's essentially the same thing. And I guess what comes out of that is that it's important in winter to maintain fitness. However you can do that. And I think stationary bikes have become very popular. I think it's a great form of exercise. Personally, I have a treadmill that when the weather's really dreadful, I'll resort to. But you can't use the weather or anything else as an excuse, because, as I tell my patients, your heart doesn't hear the excuse. Your heart is a taskmaster, if you like, not really, but it it responds to what you do, and it's indifferent to the weather. So you should be to some degree as well. Beyond that, I think, winter's a time when people sometimes slip with respect to their diet. And particularly, I think that's been a problem in the context of the pandemic. So a lot of people are eating out of anxiety. They're eating less healthy, gaining weight because of the combination of excess calories and inadequate exercise. And of course, that's another problem that we'd like to address. Now, as many of you may know, diet's my least favorite topic because it's the science of it is just very weak. But I think we all know at this point that, high fat, particularly animal fat rich diets, very high carbohydrate diets they both have their problems. And so my favorite dietary advice comes from Michael Pollan. It's eat food, not too much, mostly vegetables. And if you can adhere to that in the winter, then you're going to be a step ahead. I don't know. What's on your mind, Jeffrey? What's been, how have you been dealing with this?
I think the diet, the exercise, trying to sleep, those sorts of things to recharge your batteries, especially with dealing with the pandemic and all the stresses during everyday life. I think those things are really important. And I'm kind of curious for this audience, everybody's at a different starting point in terms of their physical fitness and exercise. And I know you see patients of all different shapes and sizes as well. Kind of, if you have any pointers, I'm curious, how do you get started if you're not in shape, or if you're kind of medium, where's a good way to do it? Or do you have tricks to kind of push yourself to get a tiny bit better each time? What are your sort of get started tips and tricks, and maybe what are some habits that you like to do and build in?
All right. So first, as I think I just made clear, you don't want to overdo it at the outset. That's you're putting yourself at risk, and you definitely shouldn't do that. So everyone should approach fitness and exercise in a sensible fashion, graded fashion. The one thing that I really emphasize a lot with my patients is the importance of frequency. And so fitness extincts very rapidly. And if you, as a runner or any kind of athlete, will tell you, if you take 48 hours off, you will notice you lose ground. And that applies pretty much across the board. So it's more important to be consistent, say every day, or say 4 to 5 days a week, than to be intense. And in fact, I would say it's much more important to get in the habit of doing something at least 4 or 5 days a week than to be doing something strenuous, 2 to 3 days a week. Because when you have these 48-hour gaps, you don't get incremental increases in fitness. And so, you get a brief, maybe increase, but then after 48 hours or a brief improvement, that'll decay and you're basically back to baseline again. But if you're consistent and you don't allow those gaps to occur, then you'll start to, your fitness will start to build. And then you can slowly increase the intensity once you've boosted your baseline.
Interesting. Yeah, I think that explains a lot of why if I take a little time off, you feel like you get it back pretty quickly, but it definitely, you feel that reset back to the beginning. So I know I try to, keep the habits. To me, it's an interesting kind of discussion about how do you get into the habit of exercising, even if it's, relatively moderate. We were just talking before the panelists and the attendees all started logging in, is some studies about looking at kind of mild or moderate exercise versus more vigorous exercise and the different advantages and disadvantages of each. But I think even if you get into the habit of it, I remember reading somewhere that if you think about brushing your teeth, if you only do it 2 minutes twice a day and you do it every day for the whole year, it adds up in total for about 24 hours, but it's so different than once a year brushing your teeth for 24 hours straight. You don't end up with anywhere near the same outcome, even though it's the same net amount of time. So to me, it's that daily habit, that daily routine. And that's a challenge, obviously, when you're busy and you're working and you have jobs and kids and family and elderly parents or whatever the case may be. You have a lot of demands. So I don't know if you've developed any tricks or if you have a morning routine or habits.
Well, I've always made time for it, and the reason is because let me take a step back first. Exercise initially may seem difficult or I wouldn't say painful, but not pleasant. Everyone I know who does it consistently will cross a threshold at which it's not painful. It's something you look forward to because the emotional and physical benefits are such that it's really, you just feel refreshed. And so if you go for a day without it, you don't feel right. And I think you want to reach that level where it's something that you look forward to. Now, that can take a couple of weeks, and I think it's important to find something that you enjoy. My wife's a big squash player. Some people like team sports. But finding an activity that engages you, that's a key component of it. But yeah, scheduling it regularly, it's part of the discipline. For me, I remember when our kids were born, I had to shift everything to the period before they would wake up, and I pretty much stuck with that ever since. That sometimes at times does not fit into a medical schedule. And of course you have to shift things around as needed. But if you have a time when you're just doing it every day, that makes it easier, making it routine. How about you, Jeffrey? When do you like to exercise?
Yeah, I definitely find I can hear exactly what you're saying about that. You just don't quite feel right if you don't get a chance to get it in. And I tend to be a morning person too. I have the same situation where I'm trying to carve out a little bit of time for the things that I want to do. I like to get up early in the morning, and I too have one of those little trainer contraptions you put on the back of your bicycle, and I brought that down the basement. So at 5 a.m, if I'm up zooming around making weird noises, I don't wake up. My kids are still pretty little, so I don't want to wake up the whole house at 5 o'clock in the morning. So to me, it means getting up early. I have to commit to it, but it's definitely something that for me, if I don't do that in the morning, I know I'm not going to be at my best throughout the day, and I definitely feel that. So, and it's the only time I can pretty much guarantee that it's all on me to make it happen that time in the morning. But certainly, like you said, but it doesn't always work. And I used to work goofy shifts and nights and weekends and holidays and all sorts of goofball times in the ER. So then it would be actually a little bit easier, because if I didn't go to work till 4 p.m. and work till 1 a.m, then I had all kinds of time during the day. So I really kind of have to adjust it. But one of the things that you said that I think is kind of fascinating is that pain of exercise. And it's something I found to be fascinating as I look at my own performances. I think a lot of people don't realize that what the human potential is. And if you get kind of out of the not in shape, the sort of weekend warrior couch potato mode, and you gradually start to improve. I found that for myself is that you kind of hit a threshold where you realize you have a first wind, and there's definitely a pain cave, an agonizing point that you get to where you just think you can't go further. And I think for everybody, and I don't know what the percentages of the population that get there, but there's definitely a huge chunk that never really experienced that. But when you break through that barrier and you realize that, I felt like crap 5 seconds ago, but now I'm like, I feel a little different now. And you get that energy, and then you can kind of go a lot further than you thought. And then you get a second wind. And then sometimes if you push yourself, you get a third or a fourth or a fifth. the potential that exists once you get through that shockwave of that first barrier, to me, from the exercise standpoint, is just a remarkable experience. And then as you do it over and over again, it seems like the agony is a little bit less. The time frame of that just grinding at the max of first gear before you can shift into second gear and feel a little more energized again, that interval of time gets shorter. And pretty soon you'll still notice it, but you actually kind of welcome it because you know it's going to go away. And on the other side of it, you'll feel better. So I know it's an experience that I didn't really get into until I started getting much more physically fit myself. And I'm just curious your thoughts on that, and what people can do to kind of push through that and experience that for themselves.
I think it's a universal experience first. I wish it were easier to get to that stage, because I think many more people would exercise regularly if they did. I think you just have to reassure people and let them know. And yeah, it's in part, it's leading by example, if you like. That I live in Jamestown and have a lot of patients from here, and I see them every morning when I'm out running. I think having an example sometimes helps. I want to also make one or two other points about the benefits of exercise. Of course, I'm a cardiologist, but there's more to life than heart disease. And the exercise is the best intervention that we have to prevent cognitive decline, so dementia. So it fends off dementia. And as I was just reading and we were discussing, it reduces all-cause mortality, not just heart mortality. So the risk of cancer and other, certainly strokes and other debilitating illnesses is reduced by fitness. So although this is your heart in winter, everything is benefited by the things you do for your heart. Along those lines, we talk a lot about controlling risk factors for cardiovascular disease, including high cholesterol, high blood pressure, reducing the risk of diabetes and smoking. And some of the findings with respect to, in particular to cholesterol and blood pressure, is that your risk of dementia goes down when you address those things as well. And dementia is a devastating illness, particularly for your loved ones. And I think it's one of the things that we should all work on.
I remember kind of an interesting concept that I have a personal trainer that I've worked out with, which is another thing that for me has been a huge motivator, just the accountability of knowing I'm going back to see this guy from time to time. And if I get too far off the rails, he's going to give me a hard time. So it keeps me motivated to keep moving. But we were talking about exercise and aging, and I think it speaks to what you were just saying. And the analogy he gave, which I thought was brilliant, you may have read this somewhere too, is that it's sort of like if your kitchen floor is a filthy mess and you accidentally spill a thing of milk or a thing of water on the floor, you're probably not just going to clean the one spot where you spilled the stuff on the floor. You're going to probably take a minute to clean the whole floor, because you're not going to leave one big clean spot in the middle of a dirty floor. And so exercise is kind of that way. When you kind of go through the breakdown and the whole physiology that happens when you exercise, your body and your immune system and everything kind of goes into a cleanup repair mode, but it doesn't just clean the one little spot that you just exercised. It kind of cleans and scrubs the whole thing. So in a way, it's kind of a fun analogy for exercise and how it fights off pretty much any disease you could think of, and just aging in general. So I think we tend to get into this as I get older. It's harder to exercise. So then you get older and it gets harder to exercise. But I think if you turn it around the other way, if you don't keep active and you don't keep moving and exercising, then you're going to age and you're going to get older much faster. And I think, you're certainly an example of how really, regardless of your youthful appearance, you can really keep your machine running remarkably well, no matter what your age is. And I think you can actually slow down the signs and the effects of aging and health, and all-cause mortality is our medical way of saying you can keep yourself from dying from just about anything if you keep yourself healthy and exercise.
Yeah. All right. Let's think of other.
So put a little call to action in the chat box. Is just and if you're not looking at that, I just put in there, don't miss an opportunity. We have Dr. Weiss on the hook, and I know lots of people reach out to me and ask for times to be able to pick his brain. So now's your chance. So you can either put right in the little chat box if you know how to do that. That's on the bottom of the screen, or there's a little Q&A box, and I'll keep track of both of those. But I'm happy to sit and talk to Dr. Weiss all night long, because I know there's a ton of stuff I like to hear about too. But if you have questions and if you want to direct the conversation, please put a little word in there. And then if you want, I can even unmute you and we can let you chat. So let's give that a go. I know
I just saw a question about COVID.
Yeah, okay, we have Liz Isdale. Do you want to ask your question? First time caller, long time listener, Liz Isdale on the line.
Can you hear me?
We can indeed. Yeah. Welcome to the show.
Okay.
Yeah.
Well, thank you for the opportunity. I really appreciate it. And with everybody always, COVID is on everybody's mind, and thinking about how it affects the respiratory system, and they're all interconnected. Just curious, what's the science behind COVID and heart?
Terrific. I think great question. And actually I've been engaged in a conversation with some national luminaries in this area. So first, COVID does affect the heart. The virus, the receptors that the virus uses to get inside cells is present on heart cells. And so it's not unusual for us to see signs of some degree of heart damage in patients particularly patients who have serious COVID infections. And we know that when we see those, that's a poor prognosticator. Now, there are, in addition to the direct effects on heart muscle, again, in very severe cases of COVID, there is abnormalities of the clotting system. So people tend to form blood clots that can cause strokes and heart attacks that we would normally not see. And actually, one of the early observations when COVID was ravaging New York City was that there were many young people coming in with strokes and heart attacks who should not have been having those kinds of events. Of course, most COVID infections are not that severe, which is obviously a good thing. The big question that I think people have struggled with is is there a subclinical problem? Are people who have less severe infections with COVID, are they at risk? Are their hearts affected? Does this mean they're at risk to have a heart attack or arrhythmias? And there were some early data that got people a little bit alarmed, and you may have seen it in the press about MRI studies that were done on young people, particularly athletes, who had been infected with COVID. And they were reporting something like a 30% incidence of evidence of infection in the heart. And that actually sounded some alarm, so that particularly the sports medicine community got very vigilant about possible cardiac complications of less severe COVID infections. And I'd say in the last month or two, it's become clear that the alarm was not appropriate, and that what we were seeing with MRI has not correlated with any sort of clinical problems. That the recommendations for screening for evidence of heart problems have really been pulled back. So, now, if you've had mild or moderate infections in the absence of symptoms, no screening is currently recommended. If you've had symptoms, then simple things like EKGs, sometimes echocardiography or ultrasound of the heart is appropriate. But in surveillance, for instance, of high school and college athletes, where there have been many, many infections, there have been surprisingly few adverse events. And of course, these are kids who are going out and they're exercising vigorously, and they're straining their hearts. And so far, it's been very, very reassuring. Again, we're looking at the more the healthier end of the spectrum. When you're dealing with severe COVID, I think that you have to bear in mind that heart disease is to some degree a risk factor, or if not a risk factor, say it tends to occur in the same population that seems to be at risk for severe COVID infections. So age is both the commonest risk factor for heart disease and for severe COVID infection. Obesity, hypertension, diabetes. So there's a lot of overlap of risk factors. So it's not clear that there's a causal relationship between, let's say, heart disease per se and severe COVID infection. It may be that they share risk factors that produce an adverse outcome. Elizabeth, does that answer your question, or do you have more?
No, that answers my question. Thank you so much. I really appreciate the detailed response.
Sure.
Curious, Joe, if we sometimes in other viruses, as you know, see these post-viral syndromes and cardiomyopathies and things.
Mm-hmm.
And I don't know if you started seeing that unique to COVID. I know with kids, we see the multi-system inflammatory syndrome, that MISC, and there's been some evidence in young people of that. But have you started to see any of the post-viral weird stuff that we sometimes see with other viruses yet?
Sure.
Anticipate?
It definitely occurs, but it's been rare. It has not been the primary problem for most people. I think we're still, other forms of circulatory failure are much more prevalent than primary myocarditis, and that at first people were very scared that was going to be a severe problem, and particularly when we saw that evidence of heart damage was a marker for severe infection. But I think it's turned out to be that it's really a marker that having COVID in your heart basically means you've got COVID everywhere, and or SARS-CoV-2. So it's not that the heart is a primary target organ, but it's a sign of a severe infection.
Makes sense.
Yeah. What did Barbara have?
Yeah, Barbara has a question. Do you want to go ahead and ask it? Looks like a good one about heart rate and exercise.
Okay, can you hear me?
Yes,
Yeah.
we can.
Okay. MS, and I can walk, but I can't walk fast enough to get my heart rate up.
Mm-hmm.
I also have a bicycle with adult training wheels on it, but I can't ride it fast enough to get my heart rate up. So how important is it to raise your heart rate to exercise? I mean, years ago, when I was younger and before the MS appeared, it was get your heart rate up, and, I would run, I would row, I could do a lot. So I'm over 70, and I just want to kind of don't know what I should do or do to get it up or not up.
Okay.
Yeah.
So Barbara, thanks for the question, and also for filling us in about your age, because that's a really important component here. So the first point I would make is that the greatest benefit from exercise is in going from being sedentary to doing something regularly. And that's where you get a huge improvement in cardiovascular mortality. So just, walking briskly, doing something regularly, you get a really substantial benefit. So much that it's been hard to show that the more extreme forms of exercise, more vigorous exercise, actually has an incremental benefit. So, doing just being active, you don't need to meet some heart rate target to achieve the cardiovascular benefits. Formally, the recommendations are so 220 minus your age times like 0.8, maybe 0.7. That's
Right.
That's a target heart rate for vigorous exercise. And if you're not achieving that, I wouldn't worry about it. It's not, you're getting the benefit as long as you're active. What kind of activity can you do?
Well, I have I walk. I have walking sticks, and I do yoga. I lift weights, and in the good weather, I have a bicycle that I ride.
Oh, Barbara, it sounds like you're doing a great job.
But I walk slowly, and I ride the bike slowly. I can't do it briskly.
Yeah, I think it sounds to me like you're doing what you can and probably what you need to. In a situation like yours, you also want to pay attention to, other risk factors and try to address those in a maximal fashion as well. So I assume your diet is good, your blood pressure is good, things like
Right.
that.
That's all good. I
All right.
just can't do anything quickly because I have balance problems, and but I move. I get out. I try to get out and move every day. It's a little bit harder now with the ice, but
Yeah. Do you have a family history of heart disease or anything that makes you particularly concerned?
My father had, back in the day, they called it an enlarged heart, and he had some valve, but he never did anything about it. He he died of emphysema.
Was he a smoker?
Yeah, he was a smoker.
Yeah.
So no, other than that, no.
Okay. So we have ways, to kind of figure out what your global cardiovascular risk is. It sounds like you had a very healthy lifestyle preceding the diagnosis of MS, and that's sort of money in the bank. That's gonna protect you, this in later stages of life. And if you have concerns or want to kind of get a sense of what your risk is and what you can do to modify it, make an appointment. I think we can kind of individualize this. We have tools to assess where you might be on the risk spectrum, and also tools to help you modify it. So exercise, we've come down pretty heavily on it here, but it's far from the only thing that matters when it comes to heart disease.
Okay, thank you.
You're welcome.
Yeah, thanks for your question. And it looks like Edna has a question along the same vein. She wrote a question about 10,000 steps a day. I've definitely heard of that before. And so I'll let Edna jump in. Did you want to ask your question?
Yeah, Doctor, I've had a lot of friends of mine that say, oh, I have to get my 10,000 steps in today. I have to get my 10,000 steps in today. And what's your thought about 10,000 steps a day?
I'm agnostic, to be honest. So it's sometimes frustrating, but I'm kind of a scrupulously scientific physician. And I rely heavily on what is the gold standard in medicine, which is our randomized controlled trials, which are very hard to do, I should say, when it comes to diet and exercise. I think it sounds like a good idea. I think it's good to have goals. And if the goals motivate you to be active, then that's a great thing. But if someone were to say, well, is 10,000 steps really better than 8,000 or worse than 15,000 or something along those lines? I don't really know, but anything that will motivate people to be active, to take care of themselves, you've got to support that, and I do. But I have to also be a little bit careful about the lack of science, shall we say. But I think to the extent that we have information or scientific information, it's that being active is better than being sedentary. And if 10,000 steps is what's going to get you off the couch, then it's a great thing.
Thank you.
You're welcome.
Or what about sitting versus standing? I have a stand-up desk. Am I doing myself any good? I've heard sitting is the new smoking. Speaking of my complete lack of science, but it sounds good.
Yeah, I mean, I have a stand-up desk too, and I think I wouldn't say sitting is the new smoking. I think that's probably excessive. Mm-hmm. But I think it feels better. It feels I get kind of stiff when I'm sitting for too long, and I don't think it'll hurt you.
One of the things I find fascinating about the human body, and I know with your research interest, you'll probably feel the same, is that I'm a mechanical guy, I'm kind of a car guy. So if you drive your car and you use it all the time, you kind of wear it out and it's going to break down and things. But the body's kind of the opposite. The more you use it, the more it repairs itself, the better it works, the more efficient. So being up, moving, active, I had a conversation with Mike Mason, who does total joints. And that was one of the questions I asked him is, how do I never need to see you ever in my life? And, his answer was, motion is lotion. You kind of keep the joints moving and things. So it's fascinating to me that two bones rubbing against each other, the more you exercise and keep active, the less likely you are to need those joints replaced in the future. So it's kind of paradoxical. It's completely backwards, where if it was a mechanical device, if you put it in a garage or a barn and covered it with a tarp, it'd be perfect. But where our bodies are completely opposite. I'm curious your thoughts as to sort of why that is. And I don't know if there's any science to back that up, but it seems like the reality to me.
Well, I think you've actually probably hit on it earlier, which is that so we have a huge capacity to repair damage, and that capacity is enhanced by being healthy, by having good circulation, not a lot of inflammation. sometimes actually very often in medicine, we can observe things that we can't explain, and that they're often counterintuitive. Lots of people have told me, well, I don't want to run because I know it's going to ruin my knees.
Right.
But if you actually look at what's happens to people who are active in running, their knees are better, so are less likely to need replacement. You might allude to the impact of obesity. Obesity certainly is not good for joints, but having metabolically active tissue, I think, is it's just a good thing. Joints and bones, of course, remodel in response to activity, in response to stress. So our bones actually sense whether or not they're being pressed, and that's why activity is one of the better ways to prevent osteoporosis as you get older. So that's not really an explanation. I think it's more of an observation, but that's often enough for us to make recommendations, particularly when it comes to health.
Yeah, no, I think it's a great way to look at it, and to me, it's just all the more reason why, no matter what your level is today, if you make it just a couple % better tomorrow, where you do a little bit more tomorrow than you did today, and then try to do a little bit more the next day than you did the day before, and push yourself to, like I joked about the brushing your teeth, try to be the person that does it 2 minutes twice a day instead of logging it and doing it once a month or once every couple months. So I think it definitely makes a big difference.
So Jeff, I think we've been pushing exercise pretty hard here, and I'm curious that in the audience if they have other questions about heart disease, because it's obviously a very big topic area.
Yeah, is anybody tired of hearing about exercise? Are you exhausted from that? Feel free to pop a question in. Otherwise, I'm going to start all my nutrition questions just to push Dr. Weiss's buttons, because I want to know if I eat fat, will I get fat? Dietary cholesterol. Okay. Does that mean my cholesterol in my blood's going to be bad? I want to know, are carbs really as evil as everybody says they are? Yeah.
All right, but nobody's coming. Jeff, you get I'm wide open.
All right. Well, I'll push you for a little primer on nutrition, because I think, at least in my readings, the 4 pillars of good health, exercise, I think we've talked a ton about. I think nutrition, if you think about the number of micrograms or milligrams in a little pill that you prescribe versus the number of grams in a cheeseburger or a hot dog, if you just look purely at molecules and weight, the food that we eat, in terms of food as medicine, we're taking in huge amounts of chemicals and things in our body. So I think it's a big piece of it. So to me, it's exercise, it's diet. I mentioned sleep, which to me, I think being able to rest and recharge is really important. And then I think your mental health and just being able to manage stress, those sorts of things. I think those are really the pillars, I think, of health and wellness. So I'm happy to talk about any one of those. I don't know if you have if you prefer to talk about sleep over exercise and diet, but yeah, the one I've been reading a lot about lately is carbohydrates. And I think we hear a lot of people talk about how maybe we've had it wrong all these years, and the American Dietary Association and the 7 grains and the food pyramids and things, maybe that's all upside down and backwards. And I've even gone so far as to read some crazy stuff about putting butter in your coffee and bulletproof things. And I think I've mentioned that one to you in the cafeteria one day. So I don't know if there's any truth to any of those sorts of things, but I'd just be curious your thoughts on that one. And then
okay, so first, I'm going to come back to science, and the problem here is that the science is not very good, and we've been wrong repeatedly. And the one thing that I think we should learn from experience is that not to reach premature conclusions. And so obviously we gave terrible advice about carbohydrates, I think, and probably did everyone a disservice. And that's why I like the simple advice that Michael Pollan has. And he's, I think, a very sensible sort of new food journalist. He wrote a good book called In Defense of Food. And the point he makes is that, we evolved in a very different environment. And to some degree, our metabolism was created in a circumstance where we didn't have access to a lot of excess calories. We didn't have access to, these ridiculous amounts of processed foods. And so just kind of taking a step back to the kind of diet in which we evolved makes sense. Now, and I buy that. I think that's important. And so when he says eat food, what he means is don't eat things that your grandmother wouldn't recognize as food, that are highly processed.
Multiple ingredients and things like that.
Yeah, the advice, not too much, well, that's kind of obvious. But then the last item, mostly vegetables, that's something that I think is gaining a lot of traction in certainly in the cardiovascular community. And I'd say the science is not, sealed, but again, it makes sense. So since that's more correlative, so we see in societies that are tend to favor more vegetarian diets, less heart disease, or more vegetable-based diets. And so, I think that's an epidemiologic phenomenon, and I think it's probably credible. So I do tend to favor that when I'm speaking to my patients.
Yeah, I found for me just the simple shift of, a meal with a side of veggies. Instead, I do veggies with a side of chicken or veggies with a side of meat. Or I'm not a vegetarian personally, so I do a little sides of things on the, or a salad with a protein buddy, as Loriana, my buddy at work, likes to call it. So those sorts of things to me seem to make a lot of sense. And
the one really good study, the one that at least I like, was done in Spain, where they basically, so the hard part here is to try to get people to change what they do when it comes to eating in a randomized fashion. So what they did was they gave people free food, and they gave them free olive oil and free nuts, etc., on the assumption that, of course, people are more likely to eat free food than food that they have to buy. And so what they did, so they're sort of biasing the diet away from animal fats like butter towards olive oil, and away from animal sources of protein to, nuts. And actually there was a pretty substantial reduction there in cardiovascular events. So that's the one that's sometimes called the Mediterranean diet study. And that's the one that I think is kind of convincing.
Yeah, it's a clever way to do a study too. It's interesting. All right, well, we'll get back into your lane of what you do every day a little bit more. So Liz, if you can come back off mute if you want, but she wrote about medications, kind of what's your threshold in terms of heart disease and addressing with medications. And then once you're on medications, are you on them for life, or is there a way to get back off of them? So I think those are good questions. I thought maybe since we have a couple more minutes, maybe we could finish off with, when do you use medications? When can you come back off medications? Let's talk a little bit about meds for heart disease.
Okay. Well, so first of all, medications, the contemporary medical management of heart disease is strikingly effective. And what we've been able to do largely with medical management is really drive down the incidence of heart disease and mortality from heart disease quite dramatically. So I think, medicines have to be used in the context where they're shown to be beneficial. That's just rational, evidence-based medicine. So you take a risk factor such as high blood pressure. We know that getting your systolic blood pressure down under 130 is going to lower your cardiovascular mortality. If you can do it with diet and exercise, that's fine, but it's pretty rare that people can. And so starting these medicines for high blood pressure, I don't have a problem with it. You have to work with people because some of them can have adverse reactions, but we have a lot of different tools in that toolbox. And addressing high blood pressure is probably one of the biggest public health interventions that can yield benefits. The other area, so where I think we've had a huge impact is in people with decreased heart function. So either because of a heart attack or chronic high blood pressure, abnormal rhythms, familial predisposition. The medicines that we've developed to improve heart function have had a dramatic impact. And the rationale here is a little bit involved, but maybe I'll just try to sketch it out. If you start with a little bit of heart damage, the way your circulatory system responds to that is as though you're bleeding. Okay? Because in evolutionary terms, that was the commonest threat, trauma. So what that means is that your arteries constrict to support your blood pressure, your heart rate goes up, the force of contraction increases, and you retain salt and water. So that really describes the syndrome of congestive heart failure. But these initial changes actually have an adverse effect on heart function. So all those things put greater strain on the heart and lead to a vicious cycle. So the circulatory response to reduce heart function leads to worse heart function, as an exaggerated response, until you can wind up with a very sick heart. And I can show you several dozen patients who have come into the hospital with hearts that were incredibly dysfunctional, who've normalized with the initiation of the medications that block this adverse cycle. Now, for people like that, we've sort of wondered, can we take them off the medicines after they've gone through this cycle? And the answer is probably we can't. So when you do that, at least a third of them will revert to heart failure over a period of, a year or two. So in that context, as long as there are no adverse reactions, I encourage my patients to stay on them because we know that that's going to be beneficial in the long term. Medications that you can sometimes come off of, well, there are certain medicines that inhibit clotting that we use in the settings of heart attacks and strokes and stents. Those you may come off after a period of time when things stabilize. High blood pressure medications, if you lose weight, I've had patients come off of those. But, you know, generally medications are started with a goal, with an intent. And if you're not meeting that goal, then you've got to stick with it. Did that answer the question?
Yeah, she was texting me about how great of an answer that was. I think she's going to be switching off as we got to the top of the hour. So,
okay.
Well, that's fantastic. And so I'll be mindful of everyone's time. I'm glad that people were able to join us. I think I really want to remind everybody that heart disease, unfortunately, is still #1 on the list of things that can take us out. And even during a pandemic, and COVID gives it a bit of a run for its money, I think it's still really wise to remember that heart disease is still so important, and it doesn't rest when we're dealing with a pandemic. So I think exercising, as we talked about, is great for everybody. And if you do none, you should do a little bit. And if you do a little bit, then try to do a little bit more. I think, you know, eating healthy and eat food, not too much, mostly vegetables, is pretty good sound advice. I like that one quite a bit. And hopefully get a chance to get a good night's sleep tonight and recharge your battery. It's like a cell phone. It does pretty amazing things and talks to outer space. But once the battery goes out, it's kind of a brick. So our bodies are the same way. If you don't recharge them, we're pretty useless. So make sure you rejuice your battery. And hopefully your soothing tones and your bow tie have reduced everyone's stress levels to a record low for the month of February, for Heart Health Month. And everybody, I think, on this little Zoom is a little bit healthier because they've gotten a chance to listen to you. So thank you for taking all the time to do this. If there's some questions that come up, I see you put your name on your Zoom thing. I don't know if you meant to do that or not, but you have Jay Weiss 2 at Lifespan. I'll invite you to answer questions. I'm Jay Gaines 1, the number 1, at Lifespan. So feel free to reach out to us to ask questions. And if you'd like to individualize your treatment, you can certainly reach out to Dr. Weiss through our Cardiovascular Institute. And I'm sure he'd be happy to set up an appointment and spend some time talking about you and your own personal health and your own personal goals. So certainly on my own behalf, I really appreciate you taking the time to answer some of my funky questions. And I just really appreciate all of the work that you do for Newport Hospital and for Lifespan and with our Cardiovascular Institute. Thank you for keeping our community healthy, helping everybody make good decisions, and encouraging folks to stay healthy and stay out of the hospital. I'd love to put the whole building out of business, and we'll make a nice little Medi-Spa retreat, lots of lavender, that kind of a thing. So that's my goal for the Newport Hospital, and I appreciate your help in that regard.
All right.
Awesome. Well, thank you so much, everybody, for joining. Thank you, Dr. Weiss, for taking the time to answer some questions. Have a great night.
My pleasure.
And we will do this again next month.
All right. Thank you, Jeffrey.
Good night, all. Thank you so much.
All right.